Question 1. A sterile processing (SP) technician is delivering a stat orthopedic tray to the operating room, and hands it directly to the charge nurse. In the context of quality management, how is this nurse classified? A. Internal customer. B. External customer. C. Quality assurance inspector. D. Primary end-user patient. Correct answer A. Knowledge point explanation. Core rationale: nurses, physicians, and other professionals working within the same healthcare facility are the internal customers of the SP department because they rely on these services daily to perform their duties. Trap analysis: option B is incorrect because external customers are individuals or groups outside the daily hospital operations, such as patients or regulatory agencies. Option C is incorrect because an inspector audits the department but is not the primary recipient requesting the tray. Option D is incorrect because the patient is the ultimate external customer who bears the risk, not the internal staff receiving the delivery. Concept extension: identifying the correct customer base is essential for setting objective quality metrics and ensuring proper communication channels between the surgical team and sterile processing. Question 2. A facility notices that biological indicator logs are consistently missing their lot control numbers. The supervisor forms a team to map out the documentation workflow, identify the bottleneck, and create a new scanning step to resolve this issue. What is this systematic continuous activity called? A. Process improvement. B. Failure mode and effects analysis, FMEA. C. Equipment validation. D. Random batch sampling. Correct answer A. Knowledge point explanation. Core rationale: process improvement is defined as the continuous cycle of identifying and resolving work-related problems to make workflows safer and more efficient. Trap analysis: option B is incorrect because FMEA is a proactive tool used before a new process is implemented to predict failures, rather than resolving an existing, active workflow problem. Option C is incorrect because equipment validation verifies that machinery functions correctly, which does not address human documentation workflows. Option D is incorrect because sampling is merely a data collection method, not the comprehensive problem-solving cycle itself. Concept extension: process management focuses on the system rather than blaming the person, ensuring that standardized procedures guide the technician to success. Question 3. How is quality formally defined within the sterile processing environment? A. The consistent delivery of products and services according to established standards. B. The ability to process surgical sets in the shortest amount of time possible. C. The elimination of all external audits and regulatory inspections. D. The exclusive use of automated cleaning equipment over manual washing. Correct answer A. Knowledge point explanation. Core rationale: quality is the consistent delivery of products and services according to established standards, meaning doing the right thing the same way every time. Trap analysis: option B is incorrect because prioritizing speed or throughput without maintaining standards directly compromises patient safety. Option C is incorrect because external audits, like the Joint Commission, are vital regulatory requirements that cannot and should not be eliminated. Option D is incorrect because manual washing remains strictly required for certain delicate or complex instruments. Automation does not inherently define overall quality. Concept extension: standardization is the foundation of quality assurance because it reduces variability and prevents errors across different technicians. Question 4. During a department meeting, the manager discusses the new water quality testing protocols, the latest ergonomic floor mats for the decontamination area, and the updated record-keeping software. Despite these various operational updates, what must remain the ultimate focal point of all these quality concerns? A. The patient. B. The Joint Commission, TJC. C. The hospital administration. D. The surgical scrub technician. Correct answer A. Knowledge point explanation. Core rationale: The ultimate goal of all quality processes in the department, from cleaning to record keeping, is to ensure safety because the patient must be the center of every quality concern. Trap analysis. Option B is incorrect because TJC is a regulatory agency that enforces standards, not the primary ethical focus of the care itself. Option C is incorrect because hospital administration manages resources and operations, acting as an internal customer rather than the focal point of health outcomes. Option D is incorrect because while the scrub technician relies on the tools, the patient is the one who bears the ultimate physical risk of an infection. Concept extension. A single microscopic error can lead to a surgical site infection, SSI, emphasizing that quality in this field is literally a matter of life and death. Question 5. Which quality process looks backward at an adverse event that has already occurred to identify the fundamental reason it happened and help prevent it from reoccurring? A. Root cause analysis, RCA. B. Failure mode and effects analysis, FMEA. C. Continuous quality improvement, CQI. D. Total quality management, TQM. Correct answer A. Knowledge point explanation. Core rationale, root cause analysis, RCA, is a reactive process that investigates an event after it occurs by repeatedly asking why, until the true, underlying cause is found. Trap analysis. Option B is incorrect because FMEA is a proactive tool used to predict and prevent failures before a process is even implemented. Option C is incorrect because CQI is a broad scientific philosophy stating that processes can always be improved, not a specific investigative tool. Option D is incorrect because TQM is a general management approach involving all employees in quality, rather than a backward-looking investigation method. Concept extension. A sentinel event, which involves death or serious injury, will always trigger a mandatory RCA to ensure the fatal error is permanently corrected. Question 6. A large healthcare network wants to completely overhaul its instrument tracking protocol to achieve an extremely low defect rate, specifically targeting a maximum of 3.4 errors per 1 million operational opportunities. Which specific quality management methodology is the administration implementing? A. Six Sigma. B. Total quality management, TQM. C. Continuous quality improvement, CQI. D. Lean system. Correct answer A. Knowledge point explanation. Core rationale. Six Sigma is a highly disciplined and data-driven strategy designed to eliminate defects and achieve near perfection in output, which is statistically defined as allowing no more than 3.4 defects per million opportunities. Trap analysis. Option B is incorrect because TQM involves all employees in long-term customer satisfaction but does not use the specific 3.4 metric. Option C is incorrect because CQI is a general philosophy that processes can always be bettered, lacking the rigid statistical threshold of near perfection. Option D is incorrect because the lean methodology focuses strictly on eliminating physical and temporal waste rather than tracking defect rates per million. Concept extension. The core framework often utilized to improve existing operational channels within this methodology is called DMAIC, which stands for Define, Measure, Analyze, Improve, and Control. Question 7. An independent auditing firm is evaluating a newly built ambulatory surgery center's internal management framework to see if it meets globally recognized benchmarks. The auditors are looking for compliance with an international standard that is not exclusive to the medical field. Which specific system are they reviewing? A. International Organization for Standardization 9000, ISO 9000. B. The Joint Commission, TJC, Standards. C. Occupational Safety and Health Administration, OSHA, Regulations. D. Centers for Disease Control and Prevention, CDC, Guidelines. Correct answer A. Knowledge point explanation. Core rationale. The ISO 9000 framework provides universally accepted international guidelines for establishing an effective quality management architecture that can be applied to any industry, including sterile processing. Trap analysis. Option B is incorrect because TJC is an accrediting body strictly dedicated to evaluating healthcare organizations within the United States. Option C is incorrect because OSHA is a federal agency focused exclusively on employee workplace safety and hazard prevention. Option D is incorrect because the CDC issues recommendations specifically regarding public health and infection control, not general international corporate quality frameworks. Concept extension. Participating in such global benchmarking helps facilities measure their consistency objectively rather than relying on subjective feelings. Question 8. While decontaminating a heavy orthopedic set, a technician observes that the mechanical washer's temperature gauge reads 105 degrees Fahrenheit instead of the required parameter. The technician immediately halts the equipment and tags it out of service without waiting for managerial approval. What management concept does this autonomous action demonstrate? A. Empowerment. B. Standard operating procedure, SOP, deviation. C. Reactive workflow management. D. Subjective quality monitoring. Correct answer A. Knowledge point explanation. Core rationale. Empowerment is a foundational aspect of quality infrastructure where frontline staff are granted the explicit authority and trust to halt operations and resolve issues instantly when they detect a failure. Trap analysis. Option B is incorrect because stopping a defective machine is adhering to safety protocols, not deviating from them. Option C is incorrect because halting a machine before poorly washed items proceed is a proactive safety measure, not a reactive one. Option D is incorrect because checking a digital temperature gauge provides objective, factual data, rather than subjective opinions. Concept extension. Leadership must cultivate a just culture where employees feel protected from punishment when they speak up about systemic defects. Question 9. Within the daily operations of a sterile processing department, how is a term like mechanical cleaning or steam sterilization categorized when discussing the sequence of activities that yield a distinct service? A. Work process. B. Quality assurance, QA, audit. C. Product recall protocol. D. Sentinel event. Correct answer A. Knowledge point explanation. Core rationale. A work process is defined technically as a series of connected tasks and work activities that ultimately produce a specific product or service, such as the entire cycle of packaging or sterilization. Trap analysis. Option B is incorrect because a QA audit is an analytical tool used to monitor long-term data trends, not the physical sequence of cleaning itself. Option C is incorrect because a recall is an emergency procedure to retrieve compromised loads, completely unrelated to the standard definition of daily operational tasks. Option D is incorrect because a sentinel event is a catastrophic patient injury, which is the exact opposite of a successful functional routine. Concept extension. To maintain high reliability, every work process must undergo strict standardization to eliminate human variability. Question 10. A tragic incident takes place in the operating room where a patient suffers a severe burn caused by an insulated laparoscopic instrument that had a microscopic pinhole crack. According to federal regulatory terminology, what is this type of catastrophic occurrence formally called? A. Sentinel event. B. Routine process failure. C. Bioburden transmission hazard. D. Internal customer dispute. Correct answer A. Knowledge point explanation. Core rationale. A sentinel event is defined by agencies like the Joint Commission as any unexpected occurrence involving death, severe physical injury, or psychological trauma, requiring immediate exhaustive investigation. Trap analysis. Option B is incorrect because a fatal or severely harmful outcome is far beyond a routine failure. It is an extreme crisis. Option C is incorrect because the scenario describes an electrical burn caused by damaged insulation, not an infection caused by retained biological matter. Option D is incorrect because this incident directly harms the external customer, the patient, physically, making it vastly more serious than a simple disagreement with surgical staff. Concept extension. Any such occurrence absolutely mandates a root cause analysis, RCA, to drill down using the 5 whys technique to uncover the fundamental systemic breakdown.